emergency medical condition that occurs when there is an interruption in blood supply to the brain. The current prevalence rate for stroke in Nigeria is 1.14 to 1,000. What does that mean? Nigeria is a population of 200 million people. So we're talking about almost over 200,000 people suffering from stroke annually. Stroke could actually occur at any age group, but the most prevalent age group that has stroke is people that are 65 years and above. There are two major types of stroke. We have the ischemic stroke, which occurs when there is a blockage of a vessel, an artery in this case, or the hemorrhagic stroke, which occurs when there is either a rupture or a leakage of a blood vessel, an artery as well. There is also what we call the transient ischemic attack, which is a mini stroke. So that occurs when there is a partial blockage of a blood vessel, which does not leave any symptoms or any long-lasting symptoms on the patient. So what does that mean? That means it just happens for a split second or minute, and then it resolves spontaneously. Unlike a major stroke, which you need to have to do something about before it resolves. Stroke, like I said before, like I narrated in the types, can be caused by either a blockage or a leakage or a rupture of a blood vessel. Now, there are things that can put one at risk of having this condition. These risk factors, these things are called risk factors, and they are subdivided into two. We have the modifiable and the non-modifiable. Modifiable simply means things you can change, while non-modifiable are things you can't do anything about. The modifiable factors are the factors you can do something about, and these include hypertension, diabetes, hypercholesterolemia or dyslipidemia, smoking, alcohol, taking of some medications, obesity, unhealthy diets, while the non-modifiable factors, that things you cannot do anything about, things you cannot change, age, the family history, the black race. It's been known from research that the black race are more prone to having stroke. Detecting stroke before it occurs is actually very difficult because, like I said initially in the beginning, stroke is an emergency condition. So it happens within less than minutes to seconds. So what we can do actually is to know the symptoms of an ongoing stroke or stroke that has occurred. Now, in this, we try to bring this down to a mnemonic called FAST. So in that mnemonic, the F stands for facial drooping. That's when a patient tries to smile and a part of the face is uneven. Then the A stands for arm weakness or weakness in any part of the limbs, either the arms or the legs. Then the S stands for slurred speech. That's when the patient cannot properly express himself speech-wise. While the T stands for time. Time is there because every time that passes and nothing is done about a stroke patient, the more the damage it is causing to the brain. When someone has a stroke, the first thing people around should do is to first call the emergency hotline. Nigeria's emergency hotline is 112. So after you've done that, you now assess the patient. You do the fast mnemonic assessment. If the patient is unconscious, then you have to perform a CPR. However, if you're not trained in performing a CPR, you need to get someone who is trained in performing CPR to conduct that, while the emergency services approach to pick the patient to the hospital. In addition to what people can do when someone has stroke, there are some don'ts, which has to do with not driving a stroke patient on your own to the hospital because of being emotionally unstable at that moment, not knowing what to do. Then secondly, not giving a stroke patient anything to eat or drink. A stroke affects almost every part of your system, and including the digestive tract, causing what we call difficulty swallowing. Now, anytime you try to give, or when you try to give a stroke patient something to drink or swallow, that could actually be a predisposing factor to aspiration, which could choke the patient and lead to death. Then we also not give them any medications to take because we don't know what kind of stroke the patient has. If it's ischemic, if it's hemorrhagic stroke and you're giving the patient an antiplatelet or a thrombolytic agent, you might predispose the patient to more bleeding, which would in turn increase the patient's chances of dying as well. So those are the ones. Stroke can be prevented by identifying those risk factors I mentioned earlier, especially the modifiable risk factors. Those things you can do something about. So if the patient is hypertensive, you ensure that you're checking your BP regularly, you're on your medications, you're observing the required diet regimen and the exercise, and avoiding what you're told to avoid. The same goes for diabetes as well. Dyslipidemia. If you're on the obese side, exercise, observe a good diet regimen. If you are having a sedentary lifestyle, try to include physical activity to your life. Then if you're on medications that could predispose you to stroke, you stop them. Treatment for stroke generally ranges from the use of emergency medications to the use of medications to manage the risk factors and the cause of the stroke. Then also the treatment also has to do with, or can also be surgical as well. These surgeries are called endovascular surgeries, where either the blockage is removed using a surgical procedure, or the leakage is kind of like blocked using a surgical procedure as well. People need to ensure that they have regular checkups with their doctor. Okay, these checkups are to check if the patient is having any risk factors, assessing their risk factors, and making sure to prevent another occurrence of stroke. Now, also in managing stroke, patients that have already had stroke will also go through what we call rehabilitative measures. This could either be occupational therapy or physical therapy. Some also with symptoms of speech or slurred speech could go through what we call a speech therapy to try to help them regain their lost function. After ischemic heart disease and cancer, stroke is like the third in the world. So I'm just trying to create awareness on how deadly the condition is and why people should be more conscious about it. So visiting your general practitioner, getting your risk factors assessed regularly, checking your BP, checking your sugar, checking your cholesterol levels, your weight, making sure your BMI is within the normal limit, and then having an active lifestyle. These are ways you can help prevent an episode of stroke. It's been said that 1 in every 4 people will develop stroke in a lifetime, so let's not be one of those people.